Hey everyone, and welcome. Today, we are jumping right into a core nursing skill you are absolutely going to use: bladder and catheter irrigation. We're going to break down exactly how to do it safely and effectively, so you can make sure your patient's catheter stays clear and working just the way it should.
So here's our game plan for this explainer. We'll start with the what and the why, then get into all the safety checks and prep work. After that, we'll walk through the procedure in 3 main phases, and finally, wrap up with some troubleshooting and the big takeaways you need to remember. Let's get into it.
All right, first up, let's lay the groundwork and talk about what bladder irrigation actually is, and more importantly, why we even do it. So at its heart, it's pretty simple. We're just flushing the bladder with a sterile solution. But the key word here, the whole reason we're doing this, is to maintain patency. Think of it like a pipe. We need to keep it open and flowing freely. This procedure clears out any clots or gunk that could cause a serious backup. And that really begs the question, right? Why is this so critical? Well, a blocked catheter isn't just some small problem. It can cause the bladder to get painfully full, lead to a ton of discomfort, and even result in some really serious complications. So yeah, this procedure is a big deal.
Okay, let's move on to safety and preparation. You know the drill. Getting this part right from the get-go is everything. It's the foundation for a successful and, most importantly, a safe procedure.
Now, these first few are your nursing bread and butter, right? Always check for allergies, always use 2 patient identifiers, and always use your standard precautions. But I really want you to focus on that last point. You cannot delegate this skill. Why? Because it requires your clinical judgment. You have to constantly assess if it's working and how the patient is handling it. That's a job for the RN, period. And here's the gear we'll need. Pretty standard stuff, but I want to point out the sterile normal saline. A super important tip here, make sure it's at room temperature. If you use cold fluid, you can actually cause the patient's bladder to spasm, which is really uncomfortable. It's a small detail, but it makes a huge difference for your patient.
All right, we've got our safety checks down. Now we're ready for phase 1, preparation. This is all about setting the stage, getting your patient and your sterile field perfectly ready before you do anything else.
Before you even touch your sterile kit, your focus is 100% on the patient. Pull the curtain for privacy, and then walk them through what you're about to do. It really helps ease their anxiety. Then, and this is so important, do a quick baseline assessment. Are they in any pain? Is their bladder already distended? You need to know this before you start so you have something to compare it to later.
Okay, now we can turn our attention to the sterile field. You'll set this up on a clean bedside table. Open your kit, pour your solution, and draw up the irrigant. But look at that last step, noting the volume. This is absolutely non-negotiable. Seriously, if you forget how much fluid you put in, your urine output calculation at the end will be totally wrong.
And that brings us to phase 2, the main event, the irrigation itself. This is where your precision, your gentle touch, and your sterile technique all have to come together perfectly.
Okay, here's a number you need to burn into your memory: 30 to 50 milliliters. That is the standard amount you're going to instill at a time. It's the sweet spot, enough to be effective without stretching the bladder too much. You will definitely see this number again, trust me.
Let's walk through this. First, clamp the tubing below the injection port. Why? Because you want that fluid going up into the bladder, not taking the easy way out down into the drainage bag. Then, you scrub that port, connect your syringe, and slowly, and I mean slowly, and gently push the solution in. We never ever force the fluid. So as soon as the solution is in, you disconnect that syringe and unclamp the tubing. From here, gravity does all the work, draining the fluid right back into the collection bag. Your job now shifts from action to assessment. You're watching that return fluid closely. What's the color? Is it thick? Are there any clots? This is how you know if you're actually making a difference.
And just like that, we're in the home stretch. Phase 3, the conclusion. We've done the main part, but finishing strong is just as important. This is all about your final checks, that critical calculation, and making sure your patient is safe and comfortable.
Okay, time for a little bit of math, but don't worry, it's easy. To figure out the true urine output, you just take the total amount of fluid in the drainage bag and subtract the amount of irrigant you put in. What's left over is what the patient actually produced. Getting this number right is crucial for accurate I&O monitoring. Once your math is done, your focus snaps right back to the patient. You're going to reassess them for any pain or discomfort, help them get into a comfortable position, and then do your final safety sweep. Lower the bed, make sure that call light is right where they can reach it. Then, clean up your supplies, and you're all done.
Last but not least, let's talk about what to do when things don't go exactly to plan, and then we'll recap the biggest takeaways you need to know.
Think of this as your quick glance guide. If you unclamp the tubing and nothing is flowing out, what's your first move? Don't panic. Just check the tubing for any kinks. 9 times out of 10, that's the problem. But if you suspect something more serious is going on, like the patient is retaining fluid, you stop what you're doing and notify the provider immediately.
And you know what they say, if you didn't document it, it didn't happen. You've got to chart the date and time, how much solution you used, what the output looked like, how your patient handled the whole thing, and of course, that final true urine output number. This is how the whole team stays on the same page.
So let's boil it all down. If you walk away with just 4 things, let it be these. 1. Sterility is king. You have to protect your patient from infection. 2. Know the why behind what you're doing. 3. Your I&O math has got to be spot on. And 4. Patient safety is the thread that runs through this entire procedure, from start to finish.
I want to leave you with one final thought. What is the #1 biggest risk that we are preventing by being so careful with this procedure? The answer is infection. Specifically, a catheter-associated urinary tract infection, or a CAUTI. Every single sterile step we just talked about is designed to protect our patients from that very serious risk. And that is our deep dive on bladder and catheter irrigation. This is one of those skills that really makes a tangible difference in your patient's comfort and safety. So keep practicing and keep mastering these skills that truly matter.
Hey, if you found this explainer helpful, do me a favor and hit that like button. Share it with a friend.